Barbara Kiriga.
Thank you, Mr Speaker. It's a pleasure to take a short call on this health practitioners bill, and it is the third reading, and we have enjoyed going through this process as a health committee. It is going to be a really good piece of legislation which is going to help us to deliver better, faster and more convenient health care to patients. And we actually heard before around coming from rural New Zealand, where we can effectively use the skills of the workforce. And we do have a lot of nurses out there who are well and truly capable of taking on further roles and further work. But at this point in time, because of this piece of legislation, the law is not in a position to enable them to do that. And so it is going to help not only our rural communities, but all other communities tremendously. So by changing to health practitioners, rather than having everything being done by medical practitioners, is going to give us a lot more scope and a lot more ability to do things in our communities. So we're working really hard to fulfil the National Government's election promise to encourage younger nurses to stay in the country after graduation through the voluntary bonding scheme, which pays off student loans for nurses, medical and midwifery graduates who agree to work in hard-to-staff communities and specialise for 3 to 5 years. And I think this is going to be a really good process for that in terms of enabling them to do what they are fully capable of doing. And as our healthcare changes, the way we deliver health services changes as well. And I've spent a bit of time since I've been the Member of Parliament on the mobile surgical buses and looking at the specialised services in some of those mobile buses which we had in Parliament during the course of while we were discussing this as a health committee. And they play a greater role in terms of bringing health services to us. And it just means that those nurses in our community are able to specialise further and help provide more services for our communities. And so I also want to commend the work that's been done by the Health Committee under our more than capable chair, Simon O'Connor. We are a very good committee. We actually work extremely well together. We're focused on what's going to provide better things for our future in our communities. And it's my great pleasure this afternoon to have the opportunity to commend this bill to the House. Thank you.
Honourable members, the debate is interrupted and set down for resumption next sitting day. The House stands adjourned until 2 p.m. on Tuesday, the 1st of November 2016.